A very good afternoon and welcome to our session on the topic Myths and Facts on IVF Treatment. We are glad to have our expert Dr. Mangala Gowri ji, who will talk about it briefly. The doctor will help us understand the topic in detail and every minute important details we can have related to the topic. So, if you have any doubts, any queries, just put in the comment section. The doctor is there to help you and guide you through it. Doctor, you have the stage.
Hello, good afternoon, everyone. I'm Dr. Mangala Gowri, IVF specialist, fertility consultant, Apollo Fertility, RR Nagar. Today, I'm going to talk about myths and facts of IVF treatment. See, IVF is basically it's a unique fertility treatment in our medical field, which has helped many of the childless couple to achieve the pregnancy and to experience the joy of motherhood. But for various reasons, many couple will have some misunderstanding, misconceptions about this fertility treatment, that is mainly IVF, which will make them not to undergo IVF treatment on time to achieve the pregnancy. So today we are making a small effort to clarify their misconceptions so that they can achieve their pregnancy on time by going for this one of the best treatment ever we have seen in our medical field. See, first of all, I would like to talk about the common subfertility cause, that is polycystic ovaries. It is one of the common subfertility condition with which women present to us in our clinic, and they are so much scared that doctor, I have polycystic ovaries. Do I require IVF? Because they think PCO is a very dangerous situation. See, what I would like to tell: 60 to 65% of the women who are having PCO, usually they conceive on their own, especially those who are having regular cycles. But about 20 to 25% of the women who are having PCO, usually they require a little bit of medical assistance in the form of ovulation induction or IUI. Followed and most of the patient they conceive with this kind of lower method of fertility treatment. But last 10% of the patient who are having severe PCO, or those who are not able to conceive with 3 cycles of IUI, or women who have undergone uh, ovarian drilling previously but they are not able to achieve follicular growth and ovulation, only such kind of women require IVF. That means to say the last 10% of the women may require IVF, but usually PCO is not that worrisome condition that I would like to tell you. The second set of women who come to our hospital are those are with endometriosis, and they're so much scared about this endometriosis after detecting on lab. Or they say, Doctor, I have endometriosis. Do I require IVF always? See, what I would like to tell is that endometriosis, the treatment for endometriosis, fertility treatment basically for endometriosis mainly depends upon the stage or the severity of endometriosis at the time of diagnosis. If it is a mild endometriosis at the time of diagnosis, if they're young women, most of them they conceive naturally or with the 3 cycles of IUI. But if they don't conceive, or if the woman is having severe endometriosis at the time of diagnosis itself, without wasting much time, they have to get into this higher treatment, that is IVF, because they have to conceive as soon as possible. Because everybody knows that it's a condition which is known to reduce fertility potential very seriously. So patient has to realize that this is a condition in which couple has to plan for pregnancy as soon as possible. The third set of women who comes to our hospital are those with low AMH. Low AMH in the sense, everybody are so scared that I have low AMH, what I should do? Should I get into IVF directly? So I would like to say, if the woman is young, if they have, if their AMH level is 1 to 1.5, they can always try lower methods of treatment like OI, or time followed by timed intercourse, or ovulation induction followed by IUI. They can try for 3-4 cycles. If they don't conceive, they can always get into IVF. But if the woman is already 35 with the low AMH, low ovarian reserve, they really require IVF to conceive most of the time, and they have to get into IVF treatment as soon as possible, because they should not be losing the opportunity of having a baby with their own eggs. So other thing what I would like to specify here, whether they're younger woman or older woman, those who are having AMH less than 0.5, and those who are having AMH greater than 0.5 after first visit itself, most of the women they require donor egg IVF. Most of the time, though not always. And fourth set of couple who visits to our hospital are those with unexplained infertility. And a common question asked by every couple with unexplained infertility is that, doctor, we don't have any problem. Why we should be undergoing IVF treatment? Why we are not able to conceive with lower method of treatment like timed intercourse or IUI? See, one thing they have to understand that unexplained infertility means we are not able to find out the reason for infertility with available tests. So this constitutes about 5 to 10% of total infertile population. So in that case, see, when we don't know the reason for infertility, then exact treatment cannot be advocated. So with the available modality of treatment, we have to treat the patient and make them. We have to get them pregnant as soon as possible. So mainly the deciding factor for the method of treatment in any couple with unexplained infertility is the age of female partner. If the female partner age is less than 32 or 33 years, they can always go for 3-4 cycles of IUI. And if they don't, if they are not able to conceive with IUI, then they can get into IVF. But in the first visit itself, woman age is 35 years and they have not conceived with the lower modality of treatment, or if they have not taken any treatment, I always say IVF would be the better option. Though they can try IUI, IVF would be the better option for them to conceive as soon as possible. And coming to the treatment part, many women they say they think many times to undergo IVF because of these hormone injections. Hormone injections what we use in IVF, they are quite safe. They are given for follicular growth, which hardly acts for 24 hours. Women are worried and they say that do they have bad effects on our health, or do they have effect on the babies which are born after IVF treatment and pregnancy. So I would like to say these injections don't have any such kind of side effects. They have least mild side effects like itching at the site of injections and slight weight gain and a little bit of drowsiness, which are all reversible in fact. And many women, they don't complain, not even these kind of side effects. They can always go for these injections without any fear. That's what I would like to tell. And usually these injections will not have effect on the baby because they hardly acts for 24 hours. That's all. And other thing, what I would like to specify during the IVF treatment is that many couples couples they say that OPO is egg pickup procedure is a major surgery. It's not so in reality. It's a small, short procedure, daycare procedure. Basically, patient will be admitted 1 hour prior to procedure, and they'll be kept for 6 hours in the hospital post procedure just for observation. Many times, women they regain conscious after immediately after the procedure itself, and they'll be able to go back to their home 6 to 7 hours after the procedure. So nothing to worry about this procedure much. They are quite safe. Most of the time they are quite safe and nothing to worry about that. And coming to the embryo transfer procedure, it's a very simple procedure which usually does not require anesthesia, but patient will be kept in the hospital for 3 hours for taking rest. That's all. Otherwise, many of them they can resume their routine activities immediately after embryo transfer. They don't require bed rest. This is the main reason why many working women they think many times to undergo IVF. So patient can resume their routine activities on the day of embryo transfer itself. They can go back to their work. Only few things that has to be avoided after embryo transfer is that they have to avoid strenuous physical activities and mental stress. That's it. Otherwise, it's a quite safe procedure. Okay, last thing what I would like to tell is that many couple they ask this question and they are very much skeptical about IVF, saying that it can cause structural abnormalities in the babies or abortions or ectopic pregnancy. See, IVF per se does not increase the chances of having increased chance of having abortions or structurally abnormal babies. The risk will be there, but it is similar to background population. So IVF procedure per se or hormone injections never increase these kind of risks. And ectopic pregnancy, when we look at natural pregnancies, it is almost 2 to 3%. But when you are looking at IVF pregnancies, it is less than 1%. And in fact, women with recurrent ectopic pregnancies, the answer would be IVF in them. So IVF, the chance of having ectopic pregnancy is less than 1%, maybe just 0.5%, or maybe 1 in 300 pregnancies, that's all. So it is quite safe to undergo IVF. So overall, I would like to tell that it's a safe, promising procedure, which I think all the couple can offer this procedure whenever required. Please undergo this procedure and to achieve the pregnancy on time. Thank you. Yeah, you can close it.